Dr. Keitumetse Mashego, who's a clinical sports psychologist, joins us now to weigh in on the type of psychological support that the families of the George building collapse might possibly need. Doctor, a very good afternoon to you. Thank you so much for being with us. Look, I suppose the trauma that comes with such an incident is quite unimaginable for loved ones. So what type of counseling or psychological assistance do the affected families need? And does it ever help in these situations? I mean, we saw a few years back when the Lily mine workers were trapped underneath the surface for days. Until this day, we know that their bodies has still not been retrieved. And their grieving families couldn't understand or come to grips with what had happened.
Yeah, good afternoon, and good afternoon to the listeners. You know, it's very difficult in this instance where such a traumatic incident happens, whereby it was unexpected. But also, you know, I don't think anybody expects, you know, such a crisis to happen when you are, you know, wherever it is that you are. So it's very traumatic. And even for the people there, you know, I think they spoke about the one survivor who's struggling with survival guilt. It sounds as if that's what he is trying to process, because he came out, but he left colleagues in there. So there's a lot of intense emotions that the family experienced, and families will continue to experience until, you know, the loved ones are found or brought out. And even in them coming out, you know, there's still psychological processing that is needed so that they can, you know, be helped deal with the crises that they find themselves in. And, you know, when bodies are found, the process of closure and grief then becomes, you know, can begin. But for some families, when they don't find the bodies, then there's just this open-ended you know, what if, and there's a lot of intrusive thoughts that are likely to happen, and a lot of, you know, intense emotions as well.
Doctor, I mean, besides the families of those that were either killed or are survivors of the building collapse, we understand that rescue workers also need this type of counseling as well as therapy. Tell us why this is.
You know, when you're dealing with, you know, such incidences, I mean, it's really abnormal. It's not a typical day, you know, that they go through this. Yes, they are trained to be rescue workers, but when it actually happens, it takes a toll, because they are also human beings. They can also have intrusive thoughts of, you know, the type of rubble that they must go through and the state of which they find the survivors or the people who are deceased as well. So they need to process all these things. They can develop vicarious trauma from just hearing the stories of the survivors and, you know, just how it was for them there, and also seeing them there. They can develop, you know, flashbacks as well, just from hearing those stories, and nightmares of having to go through this rubble, and actually, you know, just intense anxiety of their own. And also it can impact how they interact in their own relationships, whether consciously or subconsciously. And, you know, they need to also be debriefed so that there's not a lot of poor coping strategies for this traumatic experience, you know, that could display itself in the form of, you know, self-medication. And it's not just about, you know, things like alcohol and drugs. It could be, you know, food. It could be over-the-counter medication. You know, it can impact their sleeping habits, you know, whether they're sleeping too much or sleeping too little, a lot of anxiety. So they also need to just, you know, be debriefed, but also be, you know, deal with their own issues that they could be triggered by this experience. You know, if maybe they've had this sort of rescue project going on, and this could trigger, you know, past experiences as well. So there's a lot of support that is needed for the helpers as well.
And then, Doctor, I mean, how long then is this assistance, a type of assistance usually granted to the families after such incidents?
You know, it's, with psychological or psychiatric issues, it's always context dependent. You know, the things like personality and, you know, the history of the person, and also where they are coming from. You know, it's always about, you know, the resilience of a person differs from one person to the other. So there's a lot of factors that play a role. And as I said, some of the this current incidents might trigger things that were not dealt with before. Maybe, for example, a family has someone who's passed on, and then now they've got, you know, this incidents where, you know, even if someone didn't pass on, it could just trigger the anxiety of what if this person, you know, their life was no longer, you know, here. So we need to also just be aware that triggers can, you know, cause one to relive what it is that they had not dealt with, but it can also just be cause for concern how they process this due to many factors such as personality, the current status quo, the environment, and the support structure that the people find themselves in. Those are also factors that can determine the prognosis and the length of intervention needed.
Very interesting that you mentioned that, Doctor, that aspect of where they are coming from. I'm sure you've heard the reports that most of the workers that were on site have been confirmed to be foreign nationals. So getting their families to come through to this side and deal with such an issue if the families or relatives were already not on the side. So then do you think, enough relevant psychological care that we can actually accord to all the workers or the families that were affected on site?
Sadly, there are not enough practitioners to serve the country as a whole or people. But, I think as a group, they can benefit from crisis intervention. So not necessarily long-term therapy, but crisis intervention sessions to ensure that they're able to, talk about the experience, but also normalize it and also find a way to move on as a group and as individuals. But of course, those who require long-term psychotherapy intervention, then those can be referred through the, tertiary hospital system. But as I said, the public sector is already so overwhelmed because there are few clinical psychologists, for example, to assist the population. So the waiting period might be long. But I think what is to be prioritized should be the crisis intervention now, whereby they're given sessions so that they are contained and they navigate and they debrief, and there's a lot of catharsis that happens for the intense emotions that they're experiencing and the traumas, and hopefully a follow-up session and then referral for individual psychotherapy session if that is needed.
Doctor, thank you so much for your input there. That is Dr. Keitumetse Mashego, a clinical psychologist, helping us to understand the psychological impact as well as assistance that is needed in such incidents.